everyone. We're glad you could join us today, and you're watching The Doctor is In. I'm Dr. Freddy Gomez. The quarantine restrictions resulting from the COVID 19 pandemic have drastically changed our eating habits. Our living spaces have suddenly become our workspaces, and the absence of boundaries has prompted some of us to take more frequent breaks. That means a little more snacking than usual. Kung hindi naman sobrang matamis na pagkain, sobrang maalat naman. These unhealthy choices can elevate our blood pressure and increase the risk of serious complications. And this is such as hypertension, which is our topic for today. So we'll discuss with you how to detect it, how to avoid it, and why it matters more in this time of the COVID 19. So this is a very important topic because as we all know, ang hypertension or commonly known sa ating mga Pilipino na high blood ay napaka-common, napaka-pangkaraniwan sa ating mga Pilipino at marami sa ating mga Pilipino ang apektado dito sa pagiging high blood or hypertensive nang hindi nila alam. So this is another important factor para malaman ninyo, no? So we're providing you the knowledge para to assess kung talaga bang high blood ang isang tao. Okay? So with that, our guest for today is cardiologist Dr. Jose Donato Magno. Okay, so he's the executive director of the Cardiovascular Institute at the Angeles University Foundation Medical Center. Do we have Dr. Magno with us on the line?
Yes, I'm here, Doc Freddy.
Okay, great. So we're glad you could join us today, Dr. Magdo. Doc Donnie, as your patients
Yes.
commonly know you as. Ngayon, Doc Donnie, ang high blood pressure or hypertension is one of the most common diseases among us Filipinos. In the simplest terms, could you explain, Doc Donnie, ano ba talaga nangyayari kapag ang isang tao ay high blood or hypertensive?
Right. Excellent question, Doc. So when we say high blood pressure, it basically means the pressure inside the blood vessel is high or elevated, no? So that's what we call hypertension. So just think of the blood vessels of the human body, no? And if you increase the pressure inside to a certain point, what's going to happen to the blood pressure? The blood vessels, they can actually sustain a lot of injuries, and worse enough, they might even rupture or burst, di ba? So that explains some of the complications of hypertension. So, high blood pressure, simply put.
Ngayon, hypertension, as you mentioned, can also lead to some severe health complications katulad ng mga heart disease, heart attack, stroke, at pwede pa itong ikamatay ng isang tao. Ngayon, Doc Donnie, pwede nyo explain din sa ating mga viewers kung bakit ba tumataas ang blood pressure ng isang tao? Ano mga karaniwang dahilan nito?
Right. So I think that's a very important question to understand why someone has high blood pressure. Okay. So, of course, ang unang-unang isipin natin, ano ba ang mga most obvious causes of high blood pressure? No? So yung una actually is yung nakikita natin sa clinics natin, yung mga typical lolo and lolo natin with stiff arteries. Yan. So dahil sa stiff arteries ng ating mga pasyente, yan. So tumataas yung blood pressure nila. Yan. Okay, but outside of that, there are other types of patients with high blood pressure, and I want to make a comment on that. The second type is yung tulad natin, Doc Freddy, yung medyo bata pa, no? Yung mga young ones with increased adrenergic drive, madaming energy, no? Pwede actually magka-high blood kahit yung mga bata. Yung pangatlong klase ng tao na may high blood ay yung mga may problema sa kidneys. May kidney problems, no? And yung huling kind of person with high blood is hindi masyadong common. Makakita tayo, Doc, ng young female with high blood pressure pero mababa yung potassium level nila. No, so it has something to do with hormones, particularly aldosterone. So these are some of the explanations kung bakit nag-high blood ang isang tao.
That's right. Ngayon, if you're over 60 years old or meron kang underlying health conditions such as hypertension, you're considered a high-risk group during this time of COVID-19. Ngayon, Doc Donnie, ano bang nangyayari doon sa mga may COVID-19 at may comorbid or may comorbid condition na hypertension? Bakit mas delikado ang mga pasyenteng ganito?
All right. So actually, COVID-19 is something that we cannot really escape from in any discussion. No? So I'd like to make just a quick comment on that because the discussion of the pathophysiology of COVID-19 deserves a separate session altogether. But basically, we go to data from China, the earliest data. So they did an analysis of more than 1,000 patients who had COVID in China. No? And what did they find? That roughly 15% of the population with COVID had high blood pressure. But more importantly, what they realized, those people who had hypertension were at higher risk of dying. So isipin mo, may COVID ka na, tapos may high blood ka pa, mas malaki ang chance mo mamatay. The other observation they found out was that those patients who were not taking medications, they were at even greater risk of dying. So this brings to a discussion two things. Number one is recognizing that someone has high blood pressure. And number two, trying to impress upon them the need to take the medications. Yeah.
All right. Now it's time to answer some social media questions that were posted on our CNN Philippines Facebook page. Doc Donnie, let's answer some of them. Meron tayong tanong galing kay Jigs. Ang tanong ni Jigs, what is considered as normal and high blood pressure?
All right, Jigs, thank you very much for that excellent question. If you ask me what the normal blood pressure is, I will answer by saying it really depends on which guide you are following. Yeah. So many of the healthcare practitioners, and Doc is included there, would know that in the past 2-3 years, there were two guidelines from Europe and US that kind of locked horns in terms of threshold. So the European Society of Hypertension put the threshold at 140/90, while the American College of Cardiology brought it down to 130/80. So it really depends on if you will follow the American or European guideline. But Doc Freddy, I will let you know, and the audience right now, that we also need to be aware of the Philippine guideline. Tama yan. In 2011, the Philippine Society of Hypertension actually had what we call the 140/90 report. So which means up to the present day, 140/90 ang threshold as far as Philippine guideline is concerned. But I would also like to add that the normality for a particular person might actually be a little bit different. Why? Because you will hear about patients, Doc Freddy, na sabihin na, Doc, bakit 160/90 ako pero okay ang pakiramdam ko? Pero yung isang pasyente sabihin nila, Doc, nagwa-120 pala ako, nahihilo na ako. So we need to recognize that when we're talking about hypertension, Jigs, it's not just about the number. It's about the person who is having the high blood pressure. Yeah.
Okay, so very concise explanations. Thank you very much, Jigs. Now, everyone needs to take precautions to avoid getting COVID-19, but people with hypertension and other health conditions need to be extra careful. When we return, we'll talk about how to manage high blood pressure in this time of COVID-19. Stay with us right here on CNN Philippines. I'm Dr. Freddy Gomez, and we're talking about hypertension or high blood pressure. The thing about hypertension is that many people don't know that they have the condition. That's why it's often called the silent killer. We're joined today by cardiologist Dr. Jose Donato Magno. Now, Doc Donnie, if someone is hypertensive, na diagnosed na sila may hypertension, is there anything they can do to lessen the risk na kapag may COVID-19 na magka-COVID-19 sila aside from the usual precautions like wearing masks, social distancing and the like?
All right. Thank you, Doc Freddy. A very valid concern for our patients amidst the pandemic. So I guess the first answer to that is yes. A lot of things are in the hands of our patients. Outside of medications, There are a lot of things that you can do to stay healthy and to keep your hypertension in check. So I will make mention first six items. Six items, Doc Freddy. So the first, of course, is healthy diet. Huh? And it has been proven by a lot of studies that having a healthy diet will help you bring down your blood pressure level. Pangalawa, physical activity. Yes, even in the time of the pandemic, there are a lot of ways to keep active. You can swim at home, do your own gym, or walk around in the garden. Moderate exercise is very important. Thirdly, reduce your salt levels in your food. Of course, because of the lockdown, no, we have limited food choices, but again, you can proactively bring down the salt level in your food so that the blood pressure will not rise too much. Fourth, of course, is related to the above weight loss. Okay, a gradual weight reduction will also contribute to control in your blood pressure. Fifth, some patients will benefit from increasing the potassium in your diet. And I mentioned, Doc Freddy, earlier that there are patients who have what we call high blood pressure and low potassium, and they respond well to potassium supplementation. And the last one is, of course, moderation of alcohol intake. Yan.
Ayan, that's a very important last one as well. Ngayon, Doc Donnie, madalas na tanong ng mga pasyente sa akin, especially those na na-diagnose with hypertension, is kapag na-diagnose na sila with hypertension at may maintenance medications na sila, panghabang buhay na ba silang magme-maintenance na gamot? Meron bang paraan na pwede nilang gawin para maging normal na ulit ang kanilang ah, blood pressure at hindi na nila kailangan mag-maintenance medications? Pwede bang umabot sa puntong yon?
Actually, Doc Freddy, I get that question a lot of times. No? So before I answer that, I'd like to let the listeners or those who are tuned in to realize that anytime we talk about hypertension, we should have a discussion with our doctor about the three T's. So three T's. The first one is threshold. Threshold for diagnosis. We need to make sure first that you are truly hypertensive. Okay, so that basically answers the question, Doc, high blood ba talaga ako? Okay. The second T is trigger. When we say trigger, it means, oh, dahil Doc, high blood na ako, kailan mo ako gagamutin? No? At what level or what are your triggers to decide that I need medications? And the last one is target. Kung gagamutin mo ako, Doc, gaano kababa mo ba gusto pababain yung blood pressure ko? Yan. So remember, threshold, trigger, and target. Now, moving on to the question about whether maintenance medications can be taken away. I think it's very important to bring in what we call the art and science of medicine here. Some patients kasi are very scared when they say, oh, Doc, magme-maintenance na ako. It's like a stigma. So what you can do as a healthcare provider is to gently explain the need for the medications and try to give them as much power as they can in their hands. And I mentioned earlier the 6 items, the non-pharmacologic strategies. I will give you additional tips for the patient. Okay, so what I usually do when I talk to my patient is I spend the first 4 to 5 minutes talking about the 90s. Ano pansin mo, Doc Freddy? Mahilig ako sa mnemonics because right now we really need a lot of mechanisms to help us remember a lot of stuff. We talk about the 90s. These refer to the non-traditional and traditional risk factors for cardiovascular disease based on the Interheart study. So I will make mention of the 9. So I asked the patient, nagtatabako ka ba? So smoking cessation is one thing you can do. Mahilig ka ba sa matamis? Tamis. So if this patient has diabetes, we need to control that. Mataas ba ang pressure mo? So you note that hypertension is only one part of the equation. Number 4, matambok ba ang iyong tiyan? No? Meron ka bang abdominal obesity? Okay. Number 5, matalas pa ba ang isip mo? Psychosocial index is very important. Okay. Number 6, kumakain ka ba ng tanim? Yan. O lagi ka lang ba naglelechon, adobo, kare-kare, no? Preference for fruits and vegetables, okay? Number 7, ikaw ba ay natatagtag? Are you moving around, having exercise, or just sitting down during the entire lockdown? Right? Number 8, Ikaw ba ay mahilig tumagay? Yan. Okay. So alcohol moderation is very important. Finally, of course, mahilig ka ba sa taba? And there's a particular comment about cholesterol levels, which you can actually devote a separate session talking about that.
Yeah, oo nga, no? So all of those things, mukhang it sort of points towards a certain type of lifestyle, ano? Ang ma-prone sa ganitong
Yes.
mga hypertension or mga blood pressure management problems. So managing your blood pressure is always and definitely is a lifelong commitment. And if you adopt a heart-healthy lifestyle, you can significantly manage the level of your blood pressure and prevent further possible complications. Ngayon, Doc Donnie, may mga tanong tayo from our audience. Meron tayo dito
Okay.
galing kay Leonil. Ang tanong naman ni Leonil, are stress and high blood pressure related? And if so, how?
All right. Thank you, Leonil. Yes, they are related in a lot of ways. You will hear about patients coming to the clinics with elevated blood pressure because of a lot of stress. No? And I will make a comment, and I'm sure Doc Freddy has encountered these kinds of patients who have what we call labile hypertension. No? They have up and down blood pressures, or those with what we call white coat hypertension. They are the kinds of patients that are actually okay in terms of blood pressure level. But when they go to the clinic, ang taas ng blood pressure niyan dahil kinakabahan sila, takot sila, may phobia sila sa doktor, sa ospital, sa clinic, at saka sa puting baro. Yan, okay. So stress can actually bring up your blood pressure. But it is important to note that this should be transient, temporary lang. But if you see that the blood pressure consistently is high, most likely you really have some form of hypertension that we need to address. So stress management is very important in the management of blood pressure.
That's true. Thank you very much, Dr. Donnie Magno, for joining us today and sharing those very practical tips with our viewers. Now, one of the triggers of high blood pressure is the kind of food we eat. Masarap naman talaga kumain pero kailangan pa rin in. When we come back, we'll discuss the do's and don'ts of eating if you're hypertensive. Stay tuned for that. Hi, I'm Dr. Freddy Gomez, and we're glad to have you on The Doctor is In. One of the ways you can manage hypertension is by keeping a heart healthy diet. To talk more about this, we have with us Ms. Aleli Elizabeth Magtibay. She is a registered nutritionist and dietitian. Ms. Aleli, let's start with choosing the food we eat because not all of us can eat fresh food all the time. One of the things that we have to know is to read a product's nutrition label kapag pupunta sa grocery, pag bibili ng pagkain. How important are these product labels or these nutritional labels found in products? Do we have to be mindful about reading and understanding everything that the label says?
Absolutely, Doc. Particularly the nutrition facts, yung nasa likod, Doc, you have to know that. And please kindly first check. Siguro, we don't have enough time to discuss everything in the label, but I think for the nutrition facts, tingnan mo agad muna ang serving size. Una, tingnan mo yung serving size. Ilan bang servings ang makukuha ko sa pagkain na kakainin ko? And then you do the math. It will tell you gram per serving or milligram per serving, no? So makikita mo doon, ganito pala kadami ang nutrient na nakukuha ko. Specifically siguro, Doc, pay attention to some food to limit or nutrients to limit, specifically, saturated fat, cholesterol, yan. You have to make sure na tingnan mo yun, sodium, yan. So those things, fat and even fat, you have to check. Tingnan mo mabuti sana kung merong given yan na PDRI or RENI or DV, make sure that they are not exceeding 5%. Yun yung mahalaga doon, Doc. Tapos yung mga nutrient content, for example, Doc, fiber, yan, vitamins, and then minerals, make sure that sana nakakamit ng target kahit mga 15% man lang no RENI or PDRI ay namimit niya. So, meron siyang nutrients to limit at saka nutrients to get enough of, yun ang ibig sabihin nun. So, yung mga sinabi ko, total fat, saturated fat, cholesterol, yan, to limit yan. Sodium, less than 5% sana. Yung mga to get enough of, yan, protein, at saka vitamins and minerals. Sana nakakamit ka ng 15% naman. So, sana yun ang lahat. Kasi hindi rin masasaulo lahat, Doc, eh. So, dapat nakikita natin doon sa nutrition labels kung gaano kadami. Kasi minsan when you open up, pakakala mo, isang serving, isang lata, o isang pack. Hindi pala. 10 servings pala yung kinain mo na isang pack of crackers or isang pack of biscuits. So, kailangan alam natin ilang grams per serving. Yun lang siguro, Doc.
That's right. And madalas din nating naririnig o nababasa ang good and bad cholesterol. Minsan nandun din ang nakalagay lang mostly sa mga product packaging is the amount of cholesterol that is present. Pero meron ding mga good and bad cholesterol. Could you give us an idea, Ms. Aleli, kung ano yung difference ba ng good and bad cholesterol?
Maganda yung tanong, Doc. Una-muna, walang good and bad cholesterol sa pagkain. Ang cholesterol is cholesterol. So, ang bad and good cholesterol, actually, ang cholesterol na kinakain natin sa katawan natin, dapat naintindihan natin, una, ang cholesterol napuproduce ng katawan natin sa liver, no? Kumain ka man o hindi, may cholesterol ang gagawin ng katawan mo kasi we need cholesterol to build structures inside the muscle structure natin para gumawa ng vitamin D, para gumawa ng mga hormones. Kailangan natin ng cholesterol para gumawa din ng pantunaw ng taba. Ngayon, Doc, ano yung tinatawag na bad and good cholesterol? Okay, yung bad and good cholesterol, Doc, yun yung tinatawag nating mga carriers ng cholesterol sa loob ng katawan natin. So, halimbawa, yung bad cholesterol, yung LDL na tinatawag nila, siya yung nagtatransport ng cholesterol, yung sasakyan ng cholesterol, pamula sa liver, papunta sa cells. Kapag mataas ito, hindi tinanggap ng mga cells, no, nag-accumulate ito sa dugo. So, ang tendency noon, lalapot ang dugo, no? So, pwedeng tumaas ang blood pressure, yan. At pwede rin na magkaroon ng problema sa puso o yung blood flow. Kaya tinatawag siyang bad, no? Hindi naman talaga siya bad, kundi sasakyan siya ng cholesterol mula sa atay, papunta sa cells, para i-deliver yung cholesterol na kailangan ng katawan natin. Okay? Ngayon, pag sobra yung cholesterol na ginawa ng katawan natin, okay, yun ang nakakasama sa katawan natin, mataas yung LDL. Siya parang nagiging marker natin. Kaya natawag siyang bad cholesterol. Okay? Number 2, ano naman yung good cholesterol? Siya yung sasakyan ng cholesterol, papunta sa blood, pabalik naman sa liver. So siya yung parang walis, no? Siya yung scavenger. Siya yung naglilinis. Siya yung sweeper ng cholesterol sa dugo, pabalik sa atay. So, yun ang ibig sabihin ng good cholesterol. Kaya marker din siya, yung natawag nating HDL. Ngayon siguro to answer the question, pwede bang pataasin ang good cholesterol at pababain ang bad cholesterol? Maganda yung tanong na yun. Ano yung mga pagkain na dapat kainin para tumaas yung good cholesterol? At saka ano naman ang mga pagkain para bumaba naman yung bad cholesterol? Okay. Una, kung iiwas tayo sa mga pagtaas ng bad cholesterol, una muna, babalik ako sa basic. Kailangan maintain ang body weight. Maganda dapat ang timbang, kumain ng tama at mag-ehersisyo. Pampataas ng good cholesterol yan, pampataas ng HDL yan. Okay. Now, ang ibig sabihin ng pampataas naman ng mga LDL, pampataas ng bad cholesterol sa dugo would be yung mga pagkain na mayaman sa animal fats na tinatawag natin usually nasa taba ng baboy, taba ng baka, yung mga saturated fats. Meron din mga mantika na ginagamit natin na medyo mataas din sa saturated fats, no? Kaya iwas-iwas dun sa mataas yon, kagaya ng mga pagkain na mayaman nga sa sinabi ko, sa animal fats. Yun ang mayaman sa saturated fats. Iniiwasan natin yon. So, sabi nga ng Heart Associations, no, dapat ang ating intake nun di dalampas sa mga 2 teaspoons lang ng mantika maghapon, no? Yun yung saturated fat nang gagaling yun sa mga lard, yan. So, hindi sila bad talaga, kundi sana mas makonti lang ang kinakain natin. So, kung ganun, ano dapat yung mas marami ng konti, no? Mas marami ng konti, sana yung mga monounsaturated fats, yung mga mantika na makikita natin sa avocado oil, olive oil, yan, canola oil, yan yung mga unsaturated fat. At saka yung tinatawag naman natin polyunsaturated fat, makikita natin yan sa fish oils, yan. May mga mantika din na sunflower oil, sa flower oil, yan, medyo matataas yan sa unsaturated fatty acids. So kapag ganon, no, maganda ang ating balance ng ating timbang, nag-ehersisyo ka, tapos yung mantika na kinakain natin, ino-observe natin yung balance. Less of the saturated, more of the unsaturated fat. So may balance rin. Kasi kahit unsaturated, Doc, mataas din yun sa mantika, mataas din sa calories. Isa pa na dapat i-emphasize ay yung fiber. Kasi yung fiber, siya yung makakapagpababa, no, ng cholesterol natin sa katawan natin kasi hinuhuli niya yung mga mantika sa bituka, no? At ang liver natin mapipilitan na gumawa ng bile acids, no? Kasi tinatapon natin yung mga bile. So yung cholesterol sa halip na i-deliver niya sa dugo, gagawin niya ngayong bile. So bumababa ngayon ang cholesterol count natin. So dapat mataas ang intake ng fiber from whole grain cereals, so gulay at saka mga prutas, no? Whole grain, I always say whole grain, then mga gulay at prutas. Yun, Doc.
Very good. Very, very good explanation. Sana maliwanag na sa ating mga viewers ang difference nun at yung mga dapat kainin para mapa-maintain or mapababa natin ang cholesterol level natin kung sakali sila mataas. Thank you very much. Maraming salamat, Aleli Elizabeth Magdibay, for joining us again here on The Doctor's In. Always a pleasure whenever you're around. And thank you also to our viewers for joining our conversation. Remember, hypertension is a silent illness where symptoms can show up when it's too late. It's never too early to make an effort to prevent this disease. And in this time of COVID-19, staying healthy through proper diet and regular exercise is key. I'm Dr. Freddy Gomez. Keep safe always.